So we already talked about one of the reasons why you have to be careful about taking NSAIDs, the Motrin, the Aleve, the Advils, is that it can negatively impact your kidney function when you have chronic kidney disease or some other chronic diseases. You have to be careful of this particular common drug when it comes to your GI system. Over time, if you take too many of these anti-inflammatory medications, it can irritate the stomach lining and cause a slow leak or slow bleeding. You may end up in the hospital, short of breath, having chest pain, and we find that your hemoglobin is very low. Your hemoglobin is that molecule that carries oxygen to all the tissues of your body. So if you come to the hospital and you tell me that you notice that your stools are black and you're popping NSAIDs like it's candy, you're going to get a GI consult, and that GI doctor is going to do a scope and look and see if there's any irritation to your stomach lining, maybe take a biopsy or two. So you want to be very careful if you're dealing with chronic pain. Now, anemia can have other causes, so that's why you have to make sure you get your routine blood work. But particularly if you're having any symptoms that you're losing blood, if you see bright red blood, you need to go to your doctor. Don't say, oh, it's just my hemorrhoids. Don't self-diagnose. You have to get this checked out. And from a nutritional standpoint, in addition to maybe having to take an iron supplement, you want to make sure you increase your consumption of fresh, green, leafy vegetables that are rich in iron. Make no assumptions. Make sure you get a thorough workup by your PCP to find out why you are anemic, and avoid those NSAIDs as much as possible. So here's my CBC, my complete blood count. You can see the hemoglobin is in good range. And the first cousin to that blood test is the hematocrit. They'll look at that as well. That's within a good range. Sometimes you can be anemic if you're a female, heavy menstruation. There's so many reasons to be particularly iron deficient anemia, to have that condition. So you want to make sure you know your numbers. Now I'm going to come back to my CBC and talk about a couple of other numbers on it. That's going to be important for you to know about it so that you have a baseline, and that if something needs to be monitored or something needs to be worked up, your doctor will do that. So you got to have that close relationship with your PCP to know how frequently you get your CBC. And while we're on the subject of the GI system, I want to talk about your colon briefly. This subject is near and dear to me because my dearly beloved mother passed away from colon cancer. So I want you to make sure that you get your colonoscopy when you're supposed to. At this current time, age 45, for an average risk of colon cancer, you may need to get it sooner if you're having symptoms or a strong family history. I happen to get mine every 3 years, so the frequency is going to also depend on these things, and if they find polyps. So I get checked every 3 years because of my family history. You have to know when to go and make sure you're compliant with that, because early detection is key with any cancer, but particularly with colon cancer, because you can catch it early and treat it by having that cancerous polyp removed if it's caught early enough.